I'm Nick Steigerwalt, and I'm going to perform healthcare provider CPR. I'm going to go over some basic techniques, compressions, breathing. Going to go through all the steps, okay? The best way to think of this is you find a problem, you fix a problem. You find a problem, you fix a problem. A lot of people have this tendency of think of steps, and they really mess up. So think of it this way. I'm actually going to demonstrate it a couple times. So the first thing is I find my victim, and I say, hey, are you okay? Well, I found a problem. He's unresponsive. So what I have to do is fix it right away and call for help. So I'd call 911, or I'd say, hey, you call for 911 and get an AED. The next thing I'm going to do is check breathing. And this technique is to open the airway is a head tilt chin lift. And when you do this, you put your head down here. Now you're doing three things. You're looking for chest rise, listening for air, and feeling for air in your cheek. And this takes 5 to 10 seconds. You really want to take your time to get this assessment. So I'm going to tilt his head back and listen. Look and feel. There's no breathing. So I have to fix breathing. So I'm going to use this barrier device to fix breathing. The best way to use this is to cover the nose and mouth. Use both your hands to push the mask down. And you want to tilt the head back. The whole purpose of this head tilt is it lifts the tongue up so the air can pass freely. So I'm going to give him 2 light breaths. Remember, we don't want to give heavy breaths, light breaths. Just enough to get a little bit of chest rise. People have a tendency to give huge breaths, and then you get gastric inflation and vomiting. The next step is we're going to check the pulse. So again, this is a 5 to 10 second thing. So we want to take our time. We want to check this pulse for 5 to 10 seconds. Now if you're at 10 seconds and you're not sure you feel a pulse, or you don't feel anything at all, or you're just not positive, that's fine. Go right to compressions. Now there's 2 ways to find your compression point. The first way is between the nipples, right in the center of the chest. The other way is you follow the rib cage up above that xiphoid process. Now I hold my wrist like this. You can hold your hand a many assortment of different ways. The key is let your arms be locked and let your body do the work, okay? So I'm going to go through the whole thing again, and with no interruptions here. Remember, find the problem, fix the problem. Hey, are you okay? You, call for help, get an AED. There's no breathing, so I have to fix breathing. I'm going to give 2 breaths. Now I'm going to go for my pulse, the carotid artery. I don't find any pulse, so now I'm going to start compressions. The key to compressions is nice, deep, hard compressions. If you go light or soft, you're not going to perfuse the blood, and it's not going to circulate. And that's healthcare provider CPR.